Medical professionals of Reddit. When was someone's self-diagnosis surprisingly accurate? Saw someone she had a runny nose and was insistent that her cerebrospinal fluid, the fluid that surrounds your brain, was leaking through her nose and causing her to have a runny nose. This is usually pretty unlikely, especially without a history of trauma. Order a CT of her head, but doesn't show anything and she otherwise looks fine, so she's sent home. She comes back the next day with a jar of this fluid she had collected, saying this isn't not, ran some more tests and turned out she was right. I'm glad she was persistent. I naively didn't even know this was a thing until reading your comment, yet I shall now forever presume every cold or onset of allergies is an indicator of brain fluid leaking from my nose. Super. Poor woman's husband drags her to her repeatedly for weeks on end with a bizarre variety of neurological symptoms. She'd seen a neurologist and was told it was all functional. MRI showed a rapidly growing brain tumor. She was having seizures. Her husband was 100% right. My blood turns cold just typing this. Poor woman. Poor family. Had a guy come into the air. He handed me a paper on brucellosis, saying that he had an infection with brucella. Turns out he was a large animal vet professor at a university and was working in a lab studying the disease. He was right. Something like, hey doc, I'm one of the lead researchers on this disease. I know how to treat it. Here's a list of all the tests you need to run and what drugs I'll need to get better. I know how to treat it, but I don't have the script pad. Just the other week, had a 60-year-old guy, reeking of cigarettes, come in for upper endoscopy. Camera to look at the esophagus, stomach and part of the small bowel. He was describing food getting stuck mid-swallow in the middle of his chest. I think it's esophagus cancer, he said. I was thinking that too, but didn't say anything. Sure enough, that's exactly what it was. My husband had an issue with the food getting stuck mid-swallow for like a year or so. He said he just chalked it up to getting older. But when he was scanned after a motorcycle accident, doctors told him he had an 8cm mass in his esophagus. He had it removed. Thankfully not cancerous. Obligatory, not a medical professional, but I have a funny story about self-diagnosis from when I was in a motorcycle accident. It was a head-on collision and I had to go over the hood and windshield of the car that hit me and skidded through an intersection. Was wearing a helmet, boots, leather jacket. I absolutely had a massive concussion but wasn't aware of it at the time. I was not in pain. I felt disoriented and insanely thirsty, but no pain. I sat up and took off my helmet and there was a crowd of bystanders trying to get me to lay down, but I just wanted to go home. The thing is, no matter how many times I tried, I could not actually stand. When the EMTs arrived, I was sitting upright on the ground, and I helpfully informed them that I thought my leg might be broken, because I had tried to stand and found it was not weight bearing. One of the EMTs scoffed and said something like, "You think or no crap." I very sincerely insisted my leg might be broken, at which point he got serious and asked me if I had actually looked at my leg or not. I hadn't thought to do that. Bear in mind I had one heck of a concussion. I looked down, and there was my bone sticking out from my skin and through the denim of my jeans. There was blood everywhere. "Oh," I said. "Yes, your leg is definitely broken," said the EMT gently. "Well," I said, reasonably, "I mean, how do we know yet? I mean, we should probably get an x-ray. Shock is a hell of a drug." When trauma patients say, "Am I going to die?" right before they lapse into unconsciousness or get tubed for surgery, they are usually right, and they know it. Hidradenitis suppurativa, recurrent severe skin abscesses. She came in saying that she was worried she had it because she's had some abscesses in her armpit. 9 times out of 10 it's because of shaving with a dirty razor, which is what I told her. I'll be damned if she was right. Ended up having 5+ abscesses that formed tracts requiring surgery. They recurred a few months later. Sent to dermatology who confirmed the diagnosis. Worked in the OR when a lady ran in screaming that her husband was dead in the car. Staff walked out to see. I asked if they should hurry and they said no because people exaggerate those things. Turns out dude was dead. Based on the smell and bloating. Had been for 3 or 4 days. She was a junkie and was living in the car half a days before she noticed he had odd. I mean, technically they still didn't have to hurry. When I worked as a camp counselor, I woke up one morning with severe joint pain. I'd slept on the ground the night before, so I chalked it up to that. When it didn't go away after a couple days, I went to the camp nurse who diagnosed me with dehydration. After downing a 12-pack of Powerade, I'm still surprised I didn't pee blue. I still had the joint pain. A bunch of the other counselors were convinced that it was stress or that the fluid in my joints had dried up. Then I went and did the one thing you should never do. I logged onto WebMD and searched my symptoms. And right after cancer was Lyme disease. It made a lot of sense, but I'd never had any rash or notice any tick on me. So I went back to the camp nurse and she had me leave camp to get a blood test, and I ended up going into the ER because there wasn't a clinic available. The nurse gave me a shot in the butt for the pain, drew my blood, and an antibiotic on an empty stomach just in case. Turns out I was allergic to the antibiotic, so I got hives and I threw it up. I received a call the next day that yes, I did have Lyme disease. Dried up joints, my butt. Disclaimer: I worked part-time in Tridge at the ER, so I'm not sure if you'd call me a professional. That being said, I don't remember a single person who claimed they had a kidney stone who was wrong. The only person I ever had who didn't have a kidney stone and wasn't seeking, unfortunately had a ruptured ectopic pregnancy. I diagnosed myself with an adrenal tumor. My primary care doc kept telling me my symptoms were caused by lifestyle choices. I went to my gyn, who took me seriously when I showed him my research. It was a cancerous bioactive adrenal tumor the size of a grapefruit. That was over 2 years ago and I'm still fighting this cancer. I developed either recurrence or mets a few months after my initial surgery, and I've been dealing with liver and lung mets ever since. I won the argument with my primary care doc, but my prize was cancer. Sad trombone. Not nearly as dramatic, but apparently scabies, literal heck on earth, is hard to diagnose. I noticed the symptoms pretty quickly and thought my childhood eczema had come back to haunt me. When treatment for that only seemed to make it worse, I figured out that it had to be scabies. All the normal problem areas, itchy at night, etc. The problem was, I couldn't get the lotion to treat it without a doctor signing off. I went to the doctor and she immediately starts diagnosing me with everything besides scabies, while I'm telling her multiple times that it's most definitely scabies. I went 3-4 times, and the last time I left when she refused to allow me to get the treatment cream and wanted to say I had allergies instead. I told her I was not putting up with this torture while she keeps taking my money and misdiagnosing me, and she goes, "Well, I'm sorry, you aren't getting scabies treatment without a doctor's note. And I really don't think you have scabies." Apparently she never heard of Amazon. I went home, ordered permethrin, SP, 10% off Amazon. 5% is what's used for treatment. Mixed it with a thick lotion and crap cleared right up. I was so tempted to call her and let her know, but she probably would have said one of her earlier attempts at treatment finally worked. Dude, get a new doctor. Not a doctor but a patient. Had pancreatitis a few years ago, around 2014. Always had stomach problems, but no idea why until that day. 2 years later, in 2016, I had the same terrible pain. Tried to wait it out for 5 or so days, but broke down and went to the ER. I said I think I have pancreatitis, was treated like a drug-seeking alcoholic, and I stopped drinking in 2014 because of the pancreatitis. Doctor tried to tell me it was indigestion. When I asked why I was in constant pain even when I haven't eaten in 3 days was when the doctor completely changed her attitude and pretty much told me, "We're not going to help you." About 3 months later my lipase levels were high enough to be considered an attack. So I was admitted and was diagnosed with chronic pancreatitis, not alcohol related. I still think about that doctor and it makes me so angry. I wonder if my life could have been a little better if they took me seriously and found it out sooner. 2017 has been rough. That's super rough. I hope you're doing better, and that 2018 is a much better year for you. I'm not medic, but one of my co-workers is. His best story: once a woman came to hospital to prove herself diagnosed diabetic. Blood test proved it. Doctor asked how did she know it. She answered that her urine is too sticky, and it makes sense. High sugar level can affect urine too. After hurting my knee and having to ice it all the time, I found I kept breaking out in hives after the ice. I went to the doctor and told him I thought I had cold-induced urticaria, allergic to cold. My parents scoffed at it. The doctor had never had a patient with this, so it was dismissed. After it kept happening to me, I got them to send me to an allergist. My parents thought I was crazy until the doctor confirmed my diagnosis and handed my parents information on anaphylaxis. But at least now I get a handicapped parking pass in the winter and don't have to shovel the walk. I live in Canada. Not a medical professional, but I got hand, foot and mouth disease back in my senior year of high school. I knew it was that because we were working with the virus that causes it in my biotech class. Doctor told me that there was no way I had it, because only children get it, and it rarely occurs in the winter. So he ordered a couple expensive tests, and sure enough I had it. By far the most miserable 2 weeks of my life. I got it last year. I was 23. Doctors denied my claims too, since it's so rare in adults. They tried telling me I had chickenpox. I was right. HFM. Caught off my kids. Patient not doc, but I was almost as amazed as my PCP when I was right, so I'll share. My dad had been diagnosed with AFib and an arrhythmia a year prior. He was told that most people are not diagnosed until they have a problem. My dad took me and my kids to the science center where they had an exhibit all about the human body. There is a section all about the heart. They had several things that would monitor your heart rate, including a drum that would beat along with your heart when you touched sensors. Everyone else had nice steady heartbeats show up on all of the little things that they had, but mine kept acting funny and so did my dad's. The thing was, I didn't have any symptoms and I felt perfectly normal, so I didn't think that it would actually mean anything. It's basically a toy, right? I told myself I'd feel dumb if I didn't mention it to my doctor in case there was a link. When I suggested that I thought I had arrhythmia because the science center gadget didn't pick up my heart rate the same as everybody else, my doctor looked at me a little funny, but ran the tests. Sure enough, they found it and did a few more tests to establish a baseline for comparison later on in life. AFib is scary cause you can have it for years and not even know. Apple is actually using the built-in heart monitor on the Apple Watches to run a crap ton of medical studies on situations like AFib, to both help catch it early and monitor it. IDK if you have an iPhone, but if you do, look into it. I went to my doctor because I thought I had appendicitis. He agreed and sent me to the hospital. They ran tests, said I was fine and should go home. I refused. Called my doctor, who called them and made them rerun the tests with someone who knew what they were doing. They came back to me and had me in surgery within 2 hours. I had a dude come in the other night and tell us he thinks he was shot. He absolutely nailed that one. But in all seriousness, it was GSW to the head and the MRI was gnarly. Everyone with the MRI question. Most bullets are composed of non-ferromagnetic material, but yes, it is a case-by-case call. Careful consideration of risk-benefit is therefore recommended in all patients. There is an MRI screening done by an on-site rad. If one isn't available, the screening goes to a telerad facility to okay the go-ahead. This is all post-CT. My stepfather is a doctor and told me 2 stories. One was an older Irish woman who correctly predicted that she had a tumor in her left lung roughly the size of a golf ball. She has never smoked or done anything that made her a risk, but she insisted her very mild cough was the result of a large tumor and demanded to have it checked out. She was dead on and claimed she saw a person on TV with the same symptoms, and when she fell asleep her dead husband in her dream told her to go to the doctor, and her she was. The second was a guy who said he felt like he was stabbed and thought something went wrong with his surgery when they removed a cyst from his lung. He was half right. The surgery went fine, but he had a thin strip of metal shish kebabbing him through the chest because he apparently plopped onto his bed without removing some junk, including a large 6-inch receipt spike. His bandages covered up the new wound. In other words, it felt like he was stabbed because he was stabbed. Bonus. An old lady told a room full of very alarmed doctors who thought she was ridden with very dense, possibly calcified tumors that they didn't need to worry. Also, those dots are probably from the time a crazy guy shot her with a shotgun when she was 15. But it's okay now because she forgives him, as it's God's job to judge, you know. They had 2 of the pellets removed, as one was sitting on her heart and another was pressing into a blood vein, but easy to get to, and left the other 25 in. Weirdest thing my stepfather says is that she made it to 80 years old without ever getting an x-ray of anything but her foot, so there wasn't a single word of it mentioned anywhere. He apparently plopped onto his bed without removing some junk, including a large 6-inch receipt spike. Why? Why would you put that on your bed? Not a medical professional, but 4th grade me, mid 1990s, had a terrible shooting pain in my stomach. It got to the point where I couldn't walk. The doctor told me on the first visit it was probably a stomach virus and gave me some meds. I was staying home from school due to the pain and was watching Full House, and Jesse had to go to the hospital and get his appendix removed. I was so freaked out I made my parents take me back to the doctor the next day. I was crying and told the doc I think I had appendicitis. He did some checks and confirmed it. Surgery same day. After surgery they told me if it waited another few days it would have burst. Full House may have saved my life. I caught whooping cough, border telepertussis, and literally begged the doctors to run tests. Weeks and weeks passed and they just told me it wasn't whooping cough, but I was catching back-to-back flu colds bronchitis. Girlfriend also caught it and we again begged them to run tests, to which they told us they don't want it because by now they can't treat us anyways, so it made no difference. I explained that as they told me it was just a cold. I'd been going to work for weeks, well sick. I hate this too, but I wanted to keep my job so I went, and 2 colleagues have newborns, so it would be good to warn them in case they catch it off me. They ran the tests and diagnosed us, but such a pain in the butt. I watched the episode of Grey's Anatomy where there was a patient with severe migraines and Eric Shepherd can't figure out where his pain is coming from. Mark Sloan comes in, looks at him and shoves a pencil up his nose, diagnosing him with a deviated septum. For years I had suffered with migraines and headaches and recently stopped breathing fully out of one side of my nose. Stuck my finger up, felt bone. Went to the doctor a few days later. My general doctor didn't believe me. I went to an ent and told him what I thought was wrong. And by golly I was right. Severely deviated septum. Had surgery a few weeks later. My wife's OB-GYN was out of the country when she started to go into labor. Her blood pressure had been high but we were monitoring it. In the hospital it was through the roof. I looked at her chart, researched everything online and told the doctor on call that she has HELLP. He ignored me, said it was fine. When the delivery was almost done her blood pressure dropped to nothing. A nurse shot her up with something, because the doctor was busy eating lunch, and she recovered, but I will never forget holding my wife's hand thinking that this might be the last time I see her alive. When her OB-GYN got back to town she confirmed the diagnosis I gave independently. We live in a small town. The doctor avoids me. I can imagine for good reason. 2. I would have a few fists to say to someone who nearly cost me my so's life on the goddamn birthing table. Once while I was working as an EMT, we ran a call for a guy who had gotten S-faced and fell flat on his face on the sidewalk outside his apartment, cutting open his forehead. At the hospital, he was told he would be breathalyzed to obtain a back and loudly proclaimed I'm feeling .308. He promptly blew a .308 and the whole team applauded. These are the best kind of drunk people, the ones who know how fricked up they truly are. My gran was having chest pains and thought she was either having a heart attack or indigestion from a pastrami sandwich. So she went to the doctor. While she was there her BP was 210/90. The doctor said that she was obviously having indigestion and that the pain she was having was gas pockets, and prescribed her an antacid and a higher dose blood pressure medication than she was already taking. She took it and her pressure bottomed out. I took her to the hospital and found out she had been having a heart attack for the past 2 days. She died that night. I'm still bitter 18 years later. The worst part is no lawyer would take the case against him because she was old and was going to die sooner anyhow. But that's still medical malpractice. Head desk slang lawyers. My son came home from Iraq with a weird skin lesion that the army doctors diagnosed as psoriasis. I didn't buy it. I did some research online and suspected it was leishmaniasis, an infection transmitted via sand fleas. I took him to a private dermatologist and presented my research. The dermatologist sent a biopsy to the CDC and got the official diagnosis. The army still insisted on labeling it a non-specific skin irritation. They didn't want to pay for the expensive drug regime. I hired a lawyer. The army gave in and paid for the treatment. Sure, it cost us about the same to push them into it as if we just paid out of pocket, but it was worth it to force them to put the proper diagnosis into my son's records. Oh man. finally a spot to post this story. I'm a Navy corpsman, so I've heard my fair share of interesting stories and self-diagnoses from Marines. This one is probably the only one that has ever truly caught me completely off guard though. A young lady comes in and asks me in a low voice if she could talk to me in private before she made her appointment. Usually, that meant one of two things: an STD check or some sort of feminine concern, genitourinary symptoms, wanting contraception, pregnancy. So I took her to a quiet, semi-isolated area and asked her what's wrong. I have worms coming out of my anus, and I think I got it from my cat. My initial response was, okay, what makes you think that? She describes the worms and why she thought that. For the record, her symptoms were an itching in the anus, worse at night, and she had felt little wriggly things when defecating. Her cat had been diagnosed with worms and slept with them in the bed, and her husband was also showing symptoms. I take the history as best I can, go to my provider, explain it to her. She is just as confused as I am but says, well, if she says it's worms, let's get a fecal sample. And lo, she returned 2 days later with a fecal sample that tested positive. I have a couple other stories I'm happy to share, but this one was the most off the wall one. When I saw got it from my cat, I was worried where that story was going. I correctly self-diagnosed a blood clot in my leg. I went to the ER with excruciating pain in my calf and told the doctor that I suspected a blood clot. The doctor assured me that I was young and healthy and I wasn't at risk for a blood clot. He diagnosed it as a pulled muscle, offered me some painkillers and sent me home. Fast forward 2 or 3 weeks. I still had excruciating pain in my calf, and I started to develop severe shortness of breath. I went to the urgent care clinic this time. The doctor at the urgent care clinic immediately suspected a blood clot and sent me to the ER for some tests. The doctor did an ultrasound on my leg, declared that I didn't have a blood clot, and sent me home. The next morning, someone from the ER called me and sheepishly admitted that they had misread the test the night before, and I did in fact have a blood clot. It turned out that I had had a blood clot in my leg all along, and the clot had broken off and traveled to my lungs. Thankfully, I've made a full recovery, despite nearly being killed by the incompetence of multiple doctors. Very sad case. A young woman obsessed with breast exams and mammograms because she just knew something was wrong. Obviously written off by lots of doctors because the mammograms always came back clean. Until one day they didn't. She was diagnosed stage 3 when someone decided to finally take her seriously. 2 years ago I started having a short, sharp pain in my head like I had swallowed ice cream. Brain freeze. Every morning when I stood up out of bed and when I stood up after my first morning pee. I didn't think much of it. It was like this for a month and then started to become more frequent whenever I stood up. The head pain gradually started coming out of nowhere, like when I laughed or sneezed, and lasting longer and longer. Then one day it came out of nowhere so intense like a freight train in my head I was screaming in agony. It was unreal and I thought I would die, way beyond a migraine. That's when I figured out that literally as soon as I hung my head down the pain would completely go away, until I lifted my head back up. If I waited with my head down long enough, around an hour, the pain would be gone for a good while. So from then on I started just going upside down or laying down with my head over the couch whenever I felt the pain. I also then figured out that taking massive amounts of caffeine made the pain go away. The pain was still unreal every time, but I had a super easy way of making it go away. Unfortunately it started to interfere with my work, obviously because I have a desk job, software developer, and I had to take long breaks and hang my head. I actually started a new job at this time, and on literally my first day I was hit with the pain and my new boss grabbed a trash can for me to throw up in. It really became clear I had to do something. So I googled head pain when upright or something like that. Found out about intracranial hypertension, and from there, Chiari malformation. I figured out that hanging my head made my brain go back up and give CSF some more room to flow in and cushion my brain. That's why it helped. My husband drove me to the ER. I said, I think I have Chiari, please do an MRI. They did and saw Chiari and severe intracranial hypertension. Got sent to a neurosurgeon and 2 weeks later I had brain decompression surgery. From what I read, Chiari usually takes 5 years to be diagnosed. It took 1.5 years of recovery before the pain mostly went away, but it's all good now. I'm a nurse, but these are me as the patient stories. When I was in high school, I started feeling very run down. It started with a cold, then a bad sore throat. I started sleeping a lot more and didn't eat as much. At that time I was a walking garbage disposal. My dad took me to urgent care. They did the typical strep test, which was negative. My dad asked if it could be mono. The doctor laughed it off, said it was an upper respiratory virus. Take some Tylenol for pain and I can continue my normal routine. Week later, we're back at urgent care as my condition only got worse. I lost 10 pounds and was ridiculously pale for mid-August. My dad demanded a mono test. And guess what? That's what I had. The doctor then changed his tune to I need a lot of sleep and fluids. Frick you, Dr. Hermaine. Next, my first year as a nurse. I started feeling off. I would forget mid-sentence what I was talking about and entire conversations. I started getting too tired. I was sleeping 16 hours and that didn't feel like enough. I was always freezing cold, aside from the normal Ohio April, and at random intervals. My arms would either get numb or get pins and needle feelings. Got myself a primary care physician. Went to my appointment. I told the woman I'm pretty sure I'm anemic. She argued. Ordered a pregnancy test. Negative. Tried prescribing me antidepressants saying that was the issue. I got pee and demanded blood work to be done. My lab work comes back. Another round of mono and anemia. The doctor who called to tell me my results apologized profusely and we had a good laugh about maybe that's why I'm so tired. TL. DR. Frick Lake Health. I had a patient come in once because he noticed that morning that he was blind in one eye. Yup, easily confirmed. He had lost all sight in one eye, gradually over years likely, and 50% of the vision in the other. First eye examination ever. My wife suspected, based on the HCG levels from her tests versus how far along she was in the pregnancy, that she was carrying twins. The doctor thought she just tracked her cycle incorrectly, even said we were having a singleton during the first ultrasound. During the second ultrasound, found the second baby. We're now parents of twins. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.